On today's podcast.
So then you say, well, can we get new neurons in? And so you hear about stem cells and regenerative medicine. Well, lasers have a built-in capacity for stem cell proliferation of neurogenesis. And they've been shown to promote growth factors for the brain, those pathways to connect, terms like BDNF or brain-derived neurotrophic factors.
If you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Welcome to the podcast, ladies and gentlemen, brain aficionados and neural enthusiasts. Allow me to introduce you to the master of the mind and a virtuoso of the vertebrae, the one and only Dr. Trevor Berry. Hailing from the Great White North, Alberta, Canada, to be exact, I believe, Dr. Berry's a pioneer in his field. With a doctorate in his back pocket, Dr. Berry delved deep into the world of integrative neurology, functional medicine, and low-level laser therapy. Imagine lasers that aren't just flashy light shows, but tools meticulously designed to coax neurons and cells into a symphony of health. Dr. Berry is one of the leading people armed with the kind of expertise that makes other experts take notes. From being the principal investigator for FDA clearances to snagging the 2014 Researcher of the Year award for Arconia lasers, this man is laser focused on making the world a healthier, better informed place. Let's give a warm welcome to Dr. Trevor Berry. Thanks for being here today.
Wow, great to be here. Wow, that was quite the intro. I think I need to use that for all my speaking engagements, if you don't mind.
I will happily send it your way.
Thank you. Thank you for that. No, great to be here. It's really an honor. I've loved working with Vibrant over the years. You're an integral part of my world as well. So, and it's a beautiful relationship that I've had with Vibrant Labs. They do such a great job on everything I need for neurological assessment.
That's awesome. Well, I just want to jump in and start because I've read in your backstory that you mentioned that lasers profoundly changed your health and that of your family. Do you mind sharing with us a little bit more about that experience?
Yeah, I think, I think a lot of us have our stories as to why we get into certain, specialties in healthcare and whatnot. And early on, I was about 8 years in practice, and I have psoriatic arthritis is quite prevalent in my genetic lineage. And so my body started to break down doing a lot of the manual therapies. It was getting to the point where I had to quit martial arts. I had to quit working out. I couldn't even get through a whole day of practice. And I tried all the routes, conservative, nutrition, these kind of things. I did learn thereafter about, gluten-free and whatnot was actually a game changer, but I didn't know back in those days how relevant that was. But out of desperation, I heard about these light therapies helping with the arthritis. And so on a whim, I bought one just because I had no other options. I'm like, well, I'm going to try this on my wrists and hands and stuff. And within 3 weeks, I was back to practicing full time. I was back to doing all the sports I love. Yeah. So personally, it made a big change. And then with my ex, we have 2 daughters, and their side of the family, maternal side of the family, has a severe genetic predilection for Alzheimer's, really severe. And so when my daughters had to witness that in their upbringing, it could be pretty traumatizing, if as a family dealing with neurodegenerative conditions and just watching the demise and of like a grandparent or something like that. And I'll never forget when they were in tears one time, seeing this happen, they looked at me and said, "Daddy, this isn't going to happen to us, is it?" And I told them, I said, my entire existence in my field of neurology will be around protecting you two. So a lot of my why, if you will, is finding ways that I can protect their brains as well as the brains of all my loved ones, all my patient base, for hopefully mitigating this growing epidemic of like Alzheimer's and Parkinson's and all these kind of conditions. So yeah, it's very near and dear to me to find all of the cutting edge tools that we can for these, because there's not a lot of options right now. You look at the allopathic model with Alzheimer's, for example. The FDA has just now recently approved a drug that's designed for amyloid reversal, that plaque that gets on the brain. But one of the things with those kind of neurological degenerative changes, that there's not one smoking gun. You have to have a multimodal approach and assessment, because we'll get into like autoimmunity and inflammation and pathogens and all these things that lead to neurodegenerative changes. We have to be able to address all of those things.
Absolutely.
Right. And that really opens the door to what you do, Dr. Berry, which is integrative neurology. And so I have to wonder, we hear more about the term functional neurology. Is there a difference?
Yeah. So functional neurology, I'll give credit with, kind of the godfather, if you will, of functional neurology is Dr. Carrick. He's then the Carrick Institute. So they were kind of the tip of the spear, if you will, in that movement of doing brain-based applications, receptor applications that you can alter brain neuroplasticity by the way you stimulate the body. Now, we all know that in more simple terms, like we all know exercise and movement are absolutely critical, for keeping the brain healthy and really optimizing brain function, cardiovascular function, things like that. So that concept isn't a new concept per se, but people like Dr. Carrick took it to a whole different level of saying, hey, if I do this to the eyes, if I do this to the vestibular system, what change does that make in the central nervous system? How you can, the beauty of the brain is that it's very fluid and it's very plastic. Like you can make changes for the better, and you can, unfortunately, if you don't do the right things, you can make changes for the worse. And so the concept of functional neurology is saying, okay, we're going to do receptor-based applications, and it really lends itself to the chiropractic background because, for example, the chiropractic adjustment is such a powerful neurological tool, and so that's part of my armament. But I do chiropractic more based on the brain applications. Like, what if I adjust somebody's rib cage or their neck or something like that? What is it doing to the cerebellum? What's it doing to the frontal lobe? Things like that. So it's not just about, kind of local regional types of problems. And that's not to take away from that application, but I do more brain-based adjusting. But then we do all these other, vestibular therapies and eye therapies and sensory system therapies and things like that. So that's kind of the funk neuro. Well, the integrative neurology side starts to bring in more of the other applications, the nutrition and lab testing, the other lifestyle things, maybe regenerative medicine, low level laser therapy. And so it's kind of coming at it from all those different angles that may be beneficial for that patient's particular needs. So that's why I don't like to just kind of hang my hat on one side of the, one component of the equation. Because if, some of my patients, it is more receptor driven stuff where I have to do more movement based stuff and chiropractic. Others, it's, I may be doing more hormone stuff like thyroid modulation or reproductive hormones or some combination of all the above. So the message we're trying to get out to doctors going into this arena is that you want to be as well versed in all those different components so that you can address those. And I don't want, obviously that's opening up a pretty big box, right? And so it's, there are still certain things, even though I try and verse myself on all these different arenas or areas of study, there's still times where I'm like Lyme for me, for example, like that's a whole world in and of itself. So I'll still work with other specialists that's their baby, and I'll co-manage them as we work with a Lyme patient as just being one example of that. So you want to have more of a broad-based understanding. And so the more doctors get comfortable with running labs and looking at different rehab procedures and understanding nutrition and lifestyle and all that, the better their outcomes are going to be with these brain-based conditions.
Sure, fair. And thank you for explaining that. And you touched on this a little bit in terms of the therapeutics, but the difference between a chiropractic neurologist and a conventionally trained neurologist, right? And even the assessments are going to be more varied and more holistic, obviously more functional. So we're throwing around that word again, but the integrative really does pull from so many different areas. So I'm wondering, what is the conventionally trained neurologist not doing that really is at the top of your
That's
line?
such a great question, because it is something that I get asked a lot, obviously, in that so conventional medical or allopathic neurologists is typically their two main methodologies are going to be pharmaceutical intervention and surgical intervention. And the reality is, for a lot of the cases that are out there, such as traumatic brain injury or Alzheimer's or Parkinson's, there are certain limitations. Obviously, a lot of these things are not amenable to surgical intervention at all. I'm not saying there's no surgical place, if you will, in neurological rehab, but for the most part, surgeries are not going to be, those are more for, say, a subdural hematoma or maybe a glioblastoma, like a tumor of the brain. Well, there's a time and a place for that. But the medication route is, I don't want to just throw it under the bus, because there is a place for it, but it's not a great option for most neurological stuff like post-concussion syndrome, CTE stuff, things like that. Most of the medication things are going to be more for symptom treatment, like depression or something along those lines. So then they'll try and use maybe an SSRI, but even that, we're seeing more and more the shortcomings of that type of intervention. So the functional neurologist, chiropractic neurologist, its specialty is to rehab the brain without the use of pharmaceutical and or surgical intervention. And because the brain, really thrives on the way it's activated, the way it's fed, the way it's oxygenated, things like that. It's just like, think of like learning a new golf swing. You maybe have a bad golf swing and you're hooking the ball or something. Well, you can train your brain and body patterns to get a new swing and hit the ball better, more effectively, straighter, that kind of stuff. So that's the kind of rehab that we do, is like getting the brain, any network interference, any patterns that are off, where maybe parts of the brain are overactive, we do stuff to inhibit it. Maybe it's underactive, we do stuff to bring it up, and do so in a way that, again, using the complement of any and every modality that we need to say, okay, I need to fire the frontal lobe. How am I going to do that? Or, well, maybe I'm doing more fast eye movements. Maybe I'm doing more inhibitory things. If I need to fire the parietal lobe, okay, maybe I'm doing more sensory modalities like chiropractic or massage or stretching or vibration. So just depending on, when we do a full assessment, we want to get a functional map of the human body and brain. And what I mean by that is that, yeah, MRIs are fine, CT scans are fine, but the analogy I always give, if I stuck my two arms in an MRI tube and I get the report back, the radiologist may say, yep, they're symmetric, there's good tone, good mass, everything looks good. Well, how do you know one's not paralyzed? They're not functional tests. And so then you have to go back to truly doing a good bedside neurological exam. I just had a patient that came in with seizures and post-concussion syndrome, and my bedside exam was an hour long, doing full reflexes, motor, sensory, autonomic testing. And then we also do computerized dynamic posturography and video nystagmography and heart rate variability testing and all these. So really good objective biomarkers and really good thorough bedside exam. Because then once that patient paints the whole picture for me, then I can best assess, okay, now here's the part of the brain I need to stimulate. Here's the part of the brain I need to turn on, et cetera, et cetera. And in the meantime, I had her mom getting all of the labs from Mayo Clinic, just to see were there any other underlying mechanisms that may be throwing off her pH or alkalinity, or like anion gap and carbon dioxide and all these other things that may be tied into triggers for seizure-like activity or epileptiform activity. So again, it's taking that global approach of doing the assessment as well as treatment parameters, and then putting that all together. Whereas a lot of the neurologists that I work with, and this is, I don't want to come across like I'm belittling anyone, but the patients come back to me all the time. We have great specialists in my area, BNI, Mayo, all that stuff. And they'll go in, and a lot of what they're getting is a symptom assessment. And they say, okay, the neurologist will say, you've got this and this symptom. Here, let's do that. They'll either run more tests or write a prescription for said symptom. But, a lot of times my patients are coming back, they didn't even get, muscle testing, reflexes, sensory test, like they didn't get any of that stuff done on their bedside. So I think it's really important that docs come back and they really get back to being a good bedside clinician. Because you can, as fancy as all these tests are, and I love them. I love SPECT, I love DTI, I love all that stuff. But there's nothing better than a good history and a good bedside neurological exam. And so I really think that's important, that we as healthcare providers get back to doing that.
Absolutely. Well, and I love this. No stone goes unturned. You touched on so much. You jam-packed it in there. And that if we're not assessing and we're missing something, well, sure, it's easy to give symptom support, but is that sustainable? No, it's not getting to the root. And that's the theme of our podcast, of course. And so now I'm wondering, you mentioned post-concussion syndrome, you mentioned seizures, which is going to be a symptom of something else, depending on the case, of course. What are some top conditions you see?
So I do work a lot with neurodegeneration. So Alzheimer's, mild cognitive decline, dementia, other types of dementia, movement disorders. I get a lot of, Parkinson's and Huntington's and, those kind of things. Definitely a lot of traumatic brain injury, both in acute phase and in post-concussion. And a lot of migraine and headache type, complex stuff. I do take on pain still.
Super common.
Yeah, that's very
Oh, I
common.
said migraine, super common. I mean, geez.
Yeah. So a lot of headache type stuff, a lot of balance, dizziness, vertigo, vestibular type stuff. That's very common in my office as well. So.
Yeah. And we can talk about triggers all day long, but I just want to throw out some inflammatory triggers. That has to be a very common thing that you're looking at, but everything from nutrient poor diet, infections, toxins, traumatic brain injury, of course. So I'm wondering, and you mentioned neurodegeneration, can you speak to mechanism between something like post-concussion syndrome or a chronic traumatic encephalopathy, which I think is fascinating, CTE, to sum that up? How does that relate to neurodegeneration?
Yeah, so that you really hit the nail on the head. Inflammation is kind of a linchpin in most, if not all, brain-based rehab. That's one of the reasons why I love low-level laser therapy, for example, doing transcranial applications to tamp down that fire, if you will. Even going right back from a genetic predilection, you vibrant test things like ApoE4, for example. That's a common gene SNP that's associated with, a higher rate if you're homozygous for ApoE4, meaning both parents' alleles are positive for it that you inherited. You have upwards of an potentially 80% higher rate of Alzheimer's or dementia type states, and you have worse outcomes with TBI, for example. So one of the things that just because you have a genetic predilection for something doesn't mean it has to manifest. Epigenetic triggers are your big issue there. Well, the number one epigenetic trigger for gene SNPs for things like Alzheimer's is brain inflammation. That is the number one tripwire. So then going back to your original question, well, what are some of the mechanisms? Yeah, so if I get punched in the head, we have these resident cells that are called microglial cells that are like your immune cells. They're repair cells. If anyone's heard me teach, I call them the Bruce Banner of the brain, of the central nervous system.
I heard you say that.
Yeah, they're super sharp scientists by day, but if you tick off Bruce Banner, bam, and he turns into the Hulk, that's his job to protect you. It's the Hulk's job to protect you. And so you want that, whether it's acute traumatic brain injury, Epstein-Barr or herpes simplex exposure or something like that, other autoimmune type scenario, whatever. You need inflammation. You need the Hulk to protect you. But the big problem we're facing as a society is you need the Hulk to turn back to Bruce Banner. And that's ultimately the underpinnings of CTE. Because when you have that whole immune-driven inflammatory cascade, you start to have things like glutamatic cytotoxicity, peroxynitrate, superoxide anions, all these things that start wiping out neurons. And when you start wiping out neurons, you start to get cortical atrophy. Well, if you look at the brain of an Alzheimer's, like a late-stage Alzheimer's patient, you put it next to a CTE, that term you mentioned, the chronic traumatic encephalopathy, they look very similar. That cortical atrophy looks very similar. And so there's a lot of overlap between chronic inflammatory states and neurodegeneration. That's really the underpinning of that etiology or the progression of it. So then you can look at, the Western diet, very high in pro-inflammatory stuff, sugar, not eating immune neutral. We're eating like dairy and Western wheat sources and stuff that are actually not only creating barrier system disruption, because that is a huge one that we're seeing in neurological stuff, is leaky gut, leaky brain. So that's why I love your test that you have for that, the neural zoomer and the wheat zoomer and all that stuff. So you look at barrier system disruption. You look at stuff that's getting into the brains that shouldn't be there, like Epstein-Barr, like herpes simplex, like cytomegalovirus, mold, Lyme. All these pathogens are another big area of concern, because even the stuff dental, like around the biofilms and like porphyromonas gingivalis and strep mutans, all the dental stuff is getting up into the brains and tripwiring this whole inflammatory immune cascade. And again, initially that's good, but these chronic exposures to viruses and bacteria and stuff ultimately create this inferno in your brain that causes your brain to come crumbling down. And so we have to do stuff to cut off the source, if you will, or stop the source, like repair the barrier systems, like do antiviral things, like change diet, do immune neutral diet, get rid of gluten, dairy, soy, all these common denominators. And in doing so, then come in behind that, put out the fire, do the repair things, and then you've got a fighting chance. but there's no point in trying to rebuild the brain if it's still on fire, so to speak. So that's where the inflammation reduction is paramount.
Right, that's huge. And I'm wondering, in terms of, we have this neuroinflammation, and you talked about conditions that you see, maybe structural stuff has been ruled out, right? They've gone to prior providers, they've seen neurology, they come to you and you say leaky gut, leaky brain. So if we're thinking about inflammation in the general sense, how does that present? I know it can present in so many different ways, but what do you tend to see in folks?
Well, I think, from a symptom standpoint, you're seeing things like brain fog, oversensitivity to stimulus, like sight and sound sensitivity, executive function and cognition are altered because your brain's devoting too much energy to putting out this fire, and it's not, functioning properly because of that. So I think the most common one you see is brain fog. But even like, states of depression and anxiety and a lot of those neurological type presentations, inflammation is an underpinning there. Then as you get more into the labs, you can start looking at some more basic things. Like I always like to look at things like ESR, but CRP, that's a very common marker that everyone should be looking at. It's a nice, C-reactive protein is a nice general inflammation marker. Yes, a lot of things can influence it, but it's a nice window to see what's happening. And then, Vibrant has their complex chronic inflammatory testing, their SIRS testing and that kind of stuff that, then you can look at much, really expand on how much of their causation is inflammation based. So I would start with basics like acute phase reactants, ferritin, ESR stuff, then CRP, those kind of things would be good. You can make deductions of inflammation based on their dysglycemia. If their HbA1c is elevated, their fasting glucose is elevated. Those are all things that are going to be pro-inflammatory because that prostaglandin E2 COX-2 pathway. And then another one I really like is the omega-6 to 3 ratio. I mean, that's a huge marker for brain on so many levels, not just inflammation, but, when you have good, omega-3 fatty acid ratios, and we cut back on the arachidonic, the linoleic, alpha linoleic stuff that Western, the chicken fingers, the, ranch dressing, all those kind of things that Americans love to consume. The omega-6 to 3 ratio is a really good window to how well they're doing on the diet. And so that's why, intracellular, like red blood cell based omega-3 ratio is that's one of my favorite tests that I order. And I'll order it either as a standalone, but I definitely like the micronutrient and the NutriPro testing because it's built in obviously to those tests.
Absolutely.
Well, I know we're focusing a lot on the brain, Dr. Berry, and sometimes I like to come from the perspective of the listener that may not be a clinician or coming from a clinical background. And as we've talked about, nothing happens in a vacuum, right? We need to look at the whole system. Tell us how your approach considers the whole body. Dr. Emmy alluded to the gut-brain barrier, but describe that in your own words a little bit more.
Yeah, so my base screening usually gets ridiculed by general practitioners because when I run labs on patients, so I kind of alluded to the idea as an integrative practitioner, you want to look at the system in its physical form, the sensory system, the motor, the autonomic regulation, all that stuff. But, at the end of the day, you're not going to be able to exercise your way out of an anemia pattern, for example. But on the flip side, you're not going to be able to, supplement your way out of inactivity and lack of receptor activation, sedentary lifestyle. So you have to bring those two worlds together. So my baseline screen, I kind of mentioned some of those tests, my full bedside neuro history. I collect just all the data of all their testing that they've had done. I review that. Then we run a full bedside and all these advanced neurological biomarkers. But then my lab testing, I'll look at CBC with diff. I'll look at CMP testing. I'll look at, when I do thyroid, I make sure we do full thyroid, including TPO and TGB antibodies and T3 to make sure that they're actually getting the conversion. I'll look at full, reproductive hormones because people neglect to realize how much testosterone and progesterone and estrogen are neuroprotective, are important for brain function, especially the frontal lobe. So it's really important to look at chem profiles and blood analysis because I could be firing a patient's pathway all day long with these cool, functional neurology things, but if they are anemic or something, it's not going to stick. And so we have to make sure we're not missing those key components. And so finding a healthcare provider that's willing to look at the labs and more of those kind of profiles, look at your diet and lifestyle, nutritional profile, and look at the full brain, body, neurological assessment. You want to have, as a general thing, have all of those pieces to really truly get an assessment on how the body is doing.
And I love that you pointed out, Dr. Berry, looking at routine labs, for example, a CBC for missing anemia, because a lot of patients, they don't go to a primary care provider. And there's many reasons. I'm not going to get into that. That's, Pandora's box. But finding a practitioner who's willing to look at those labs and, at best order them and understand them and be able to really look at them on a functional level. There's resources out there to help you do that. That's so important. I'm always talking about that, and not necessarily just to get a diagnosis. We don't want to just focus on the diagnosis, but we don't want to miss anything either. So
yeah.
I appreciate you saying that.
Even if you're not comfortable with, the clinical management of a lab marker, Vibrant has a wonderful clinical team that you can consult with, and they can walk.
Yes, we do.
Yes, so that's one thing. But B, working with other healthcare providers, at least, if it's out of your pay grade, that's fine. But, at least find other nutritionists, maybe a naturopath or whatever that's more comfortable with working in those, and just work right alongside them, even if they're not comfortable with it. So that's a big thing. But it's funny you bring that up, because one of the questions I'll ask in my seminars is, I'll say, all right, what's the most important lab marker for the brain? And I give all the docs a chance to think about it. And I'll just go hand the mic and most people don't want to make eye contact with me, right? They're like, oh God, he's going to ask me. And a lot of people say, I don't know, which is fine. But then some people say, okay, C, vitamin D, CRP, whatever. They say all these markers. And then I ask them, okay, well, what's yours at? And they pause and they look at me like, I don't know. And then I'll say to the next one, they'll say homocysteine. I'll say, well, what's yours at? And they'll say, I don't know. So one of the things I want healthcare providers to do is start testing themselves first. Yeah. Run these things on themselves to get, because we're not going to be good providers if our own brains are going down the toilet. So I always implore doctors to run tests on yourselves first. Get comfortable, even just that basic assessment on your own labs. That way you don't have to, if you want to take a month to look at the labs and figure it out, it's your own body. So you can, that kind of thing. Yeah. But just start to do it like that and build it up, and then use the resources like the Vibrant clinical team and whatnot. Go to seminars that are teaching these things like we do in our seminar series. We bring up labs in every seminar for a reason, because it's such an integral part of brain health and neurological health.
That's such a great tip. And I often hear providers say they're the worst patients. So I think you're just, you're showcasing that. But
yeah. But let's turn it around. But I also feel that we make good guinea pigs, and we are we as collectively, we're all very interested in our own data and our own personal stories. And we could go down that rabbit hole. So that's a great practical tip. I love that. Okay. I think it's time to get into lasers. What do you think, gang?
Uh-oh, there we go.
Let's do it.
Let's talk lasers. Okay. I'm going to make a little bit of a bundle of some questions here. So I want to know, what is low-level laser therapy? What's the mechanism of action? How does it apply to brain health? And then I want to get into the colors, but let's take it one step at a time.
Yeah, so I think the easiest way to describe it, most people, no matter what your level of training is, or whether you're a healthcare provider or not, understand that we are light-driven beings. We don't exist as a species. Plants don't exist without sunlight, right? So light energy is the driving force between so many different components of what we do, what we eat, that kind of stuff. So there is the chemical, that biochemical model that we've already started to kind of to delve into. But when it comes to mitochondrial output and brain function and whatnot, it's based on biophotonics, and energy through those mechanisms is huge. And so the thing with light therapies is that they check off so many boxes for the brain. Here's just a short checklist, for example, of things that it will do for brain. And this is all based on peer-reviewed published literature. But I also see this stuff clinically as well, is that when you shine a light on somebody's head, it has the potential to create neurogenesis. So one of the holy grails in brain rehab is that brain cells are not mitotic, meaning unlike a liver that can turn over in a few weeks, or a gut lining that can turn over in a few weeks, once you lose a neuron, it's dead. right? So then you say, well, can we get new neurons in? And so you hear about stem cells and regenerative medicine. Well, lasers have a built-in capacity for stem cell proliferation of neurogenesis. And they've been shown to promote growth factors for the brain, those pathways to connect, terms like BDNF or brain-derived neurotrophic factors. So shining a light on somebody's head has been shown to do that. It promotes mitochondrial output, the energy, the powerhouse of the cell. Those rate-limiting enzymes that are on your mitochondria, there's five enzymes. 4 of them are rate-limiting. So there's complex 1, 2, 3, 4, 5. And we've just found out, and I'll get more into that when we talk about colors, but each of those complexes responds best to a different color of wavelength. So when you think about energy for the brain, whether it's keeping the brain alive in just aging process, all the way on down to recovery from a head injury, you need energy. It's the most metabolically, the eyes, the brain, the gonads are the main energy consuming parts of the human body. So the more energy you can create, the better. Well, this will promote mitochondrial output and energy production by over 50%. Then you have all your antioxidant systems are promoted. So all those free radical fighting systems, your glutathione, your superoxide dismutase, catalase, all that stuff is promoted by light energy. Anti-aging, the telomere shortening, and the NRF2 systems are promoted by lasers. The barrier system repairs. So it almost starts to sound like too good to be true. Like, well, what is the catch? Just shining this light on my head can do all.
It there.
Yeah, I've got. Oh, actually, this is one of my babies right here. That's one of the scanning lasers. I'll turn it on in a bit. But when you do this, you're like, okay, by shining this light on somebody's head, you can actually promote all of those positive physiological repair things. It even has an antimicrobial component. Like we all know UV light is good for viruses and bacteria and stuff like that. Well, violet laser has all the similar benefits to UV light, but it's not as toxic to mammalian cells. Like if you go out in the sun too long, you'll get burned, that kind of thing. So if it's in the visible spectrum, it actually has all those, like this laser right here has been shown to take out MRSA, for example. So when I'm working with viruses like Epstein-Barr or herpes simplex 1 or 2, whatever that we're seeing in the brain that I've tested on your Neural Zoomer Plus, test, that's where I'll go after with things like laser to the brain, because it has a immune boosting antimicrobial property to it. So then the question is, all right, all this stuff, that's too good to be true. What is the catch? And the big thing with laser is that there's a Goldilocks window, is that it's based on you do not want to exceed a certain dose to the brain. And the research shows you want to ideally stay below 10 joules per centimeter squared. Now, don't worry about that. That sounds Greek to most of the audience. But just know that that some laser is good, but it doesn't mean more is better, because these higher powered lasers have not been shown to be as effective. And if anything, they can actually be detrimental. So higher powered lasers don't have FDA approval and clearance to do brain-based stuff. They have approval for heat. And that's what those longer wavelengths do. Well, you both probably do like infrared saunas, right? Red saunas and things like that. Well, that's those longer heat wavelengths. There's a purpose for that. We like those, but I don't want to do that to my brain, because now you're getting up those longer, more powerful diodes and whatnot they're more heat producing. So that's more for detox, like mold or something like that. But the next phase up from that is microwaves, and those are just even longer waves that are vibrating water molecules and cooking them. And I always tell doctors, I'm not trying to stick my head in a microwave and turn it on. That is a bad idea. So what we like to do is make sure we're below 16 joules per centimeter squared. But I tend to get doctors to do below 10 joules per centimeter squared. So then you get all the benefits of those light therapies without putting the brain at risk. And that's why I attach my Carter-Erconius horse, because as I start, like now I'm up, I quit counting at about 5,000 laser papers that I've read. And as I was reading through what I was going to do on my daughter's brains, I wanted to, number one, make sure I was doing no harm, right? Our number one thing as physicians is do no harm. So I'm like, what is the safest, dose, and what are all the safety parameters? Right. And then I looked at what are the best wavelengths and things like that. And so it turns out that the lower power, like class 2 lasers that are true lasers are perfectly in the sweet spot. And that's why I use Erconia lasers, is because they are perfectly situated to be safe, but also in the right dose and wavelengths. And then the last thing on that is the energy. So the shorter wavelengths actually have more energy. And so one of the big things that we brought to the market was that they are the first, and I'll turn this one on. This is the brand new green violet laser. So you can see green and violet is actually the highest energy producing laser that you have. So you have to differentiate between dose and energy. So dose is just power, and that really cranks up the joules, and you don't want that. Energy, the faster waveforms are higher energy, and so that's the perfect thing when you get into the lower red, which is around 660 to 630 nanometers. That's the low end of red. That's really good. And then violet or green's next, around that 520 to 532 nanometers. And then violet is the most energetic, and that's at the 405 nanometers. And what that does is when you get that light energy, that's what takes the electrons of your atoms and puts it to higher valence. And then when it drops, that's what gives you the energy. That's what gives you the gas, if you will, for all this mitochondrial, all that Krebs cycle stuff. Everything that you're doing as a human is based on that energy production. So by getting that right dose and wavelength of high energy, low dose into the brain, now I've got the energy to make magic happen, so to speak. And it's perfect. So it's safe and effective.
So if I come in and just say, give me the rainbow, you just point them all at me. That might not be the best way to go.
I definitely do that. I like that idea. So we can double up, and that's what I'll do on my lunch. I'll put all 3 wavelengths on my brain now and even now, what's another interesting thing, just kind of a side note, is that they're showing a lot of research now on those mitochondrial complexes with Alzheimer's, ALS, autism. Like, have you heard of the class action lawsuit that's going on with Tylenol right now?
No, please tell us.
Yeah, there's a class action lawsuit, and what they found is that acetaminophen, what it does is it wipes out the mitochondrial complexes. Oof. And that's one of the underpinnings they're finding with autism rates is that mothers that took Tylenol are showing higher rates of autism and developmental delays and things like that. And so there's actually, I'm not a litigious person, but there's a class action lawsuit right now against Tylenol for this reason. So then you have to figure out, well, what are you going to do to repair and protect those and increase the output of those mitochondrial complexes? Well, that's where it goes to the colors, because the 1 and 2 complex of the mitochondria responds to violet, number 3 responds to green, and number 4 responds to red. So by getting that whole array, we're having even better outcomes with dementia cases, with autism cases, with all these different things that actually require multiple different wavelengths or different mitochondrial complexes for optimal outcome.
That's the awesome. Rainbow therapy.
Yeah.
I'm going to sign up.
Yeah. I'm going to take a slight left turn here, and then I want to get back to this. But I heard you speak on another podcast, and this stuff just fascinates me. But using like meditation, memory recall, positive thoughts while you're doing the laser, it can increase the benefits. Talk to us a little bit about what's happening there.
Yeah, so I love that you brought that up, because I think that's such an integral part of getting the most out of these devices, is that if I've done all my testing, I've gotten all their nutrients up and I've changed their diet, and then I'm giving the brain all that good laser energy to make all that magic happen. Well, the last piece, I shouldn't say the last, but one of the main remaining integral parts of the puzzle is to activate the brain. Now, activation may mean doing memory recall. Like there's some really good apps like Lumosity and Elevate and Brain HQ. Maybe I have a patient doing that while they're doing their laser therapies. Or their studies have been shown that meditation can increase gray matter of the hippocampus. Well, that's the main area where Alzheimer's starts, is the hippocampus starts to go south. That it's deep in the temporal lobe, the memory part of the brain, that part of the brain right there. And that deep medial part is that where the hippocampus is. Well, if you meditate and do it properly, you can actually increase gray matter activity. Well, why not combine that with lasers that have been shown to do the same thing? Now you've got this beautiful 1-2 punch. Or if you're dealing with a depressed patient, have them do things like meditation of gratitude, and that will actually start to re-hardwire their brain. Instead of being all negative thoughts, they actually start to re-hardwire that things like their default mode network to start having more positive thoughts and circuitry in their brain. Or maybe I have them doing eye exercises, or maybe I have them doing olfactory, like sense of smell stimulation, or binaurals, where we put different frequencies into their auditory system and the brain picks up that. So then when you start stacking these modalities, it allows them to do that much more exercise before they fatigue, as one example. Because that's a big thing. Like, say I'm dealing with a traumatic brain injury, and they start to do a rehab procedure, but then their brain crashes. Well, when I put the lasers on their brain simultaneously, they may be able to double their exercise load without crashing, for example. And so it gets them through their recovery that much quicker. Or even just in simple terms, there's a lot of research, just like FDA clearances on these devices, where if you have an operation, for example, or a fractured bone or whatever,
Wow.
So a bone fracture that may take 8 weeks typically to heal, maybe like a clavicle or something. I've had patients come back after 4 weeks completely healed. And their orthopedist is like, what just happened? You're like,
Wild.
What are you
yeah,
doing?
and then they'll say, "Oh, my crazy doc did this laser therapy," and they're just like, "What?"
Yeah.
It's so funny because they dismiss it, but at the same time, the literature's all there. I mean, there's almost 13,000 papers, I think, last I looked, on low-level laser therapy. So it's not like the research isn't there to back this up.
Yeah, that's so fascinating. I'm so glad we're talking about this, because I would imagine a lot of people haven't really delved into this. So this is great.
Well, I think the brain stuff is like what all my audience, I don't care what your specialty is, whether you're an MD, DO, DC, naturopath, whatever, if they surveyed their patients and took a survey and said, who of my patient base is interested in protecting their brain, trying to prevent things like Alzheimer's, like dementia, things like that, show me who. Yeah, exactly. It's 100% every time.
Right.
That one person that says no, they're the ones that need the brain rehab the most. Something obviously. So
They need the laser.
Yeah. So even if doctors don't want to kind of dabble in this in their practice, my big thing is do this on your own brains and your family members. Even if you don't do a single thing I talk about in the entire weekend in their practice, at least do it for yourselves to protect. That's such a big component, because at least we're still spreading exponentially, helping people, trying to find ways to protect their brains.
Sure. Okay. Now I'd love to know, you touched on it a little bit, but the therapy session, the laser therapy session, what does that look like? How long does it take? For people who are not watching and who are only listening, Dr. Berry, you just held up a couple of your lasers. Do you have are you standing there? I mean, is there a cap? Those caps like for alopecia? I've got to know. What kind of applications do we have?
Let me come back to those caps. So all of my lasers, you can handhold them. That's why I just had these. Or they could be on the stand, like these scanning lasers. That's a mobile stand. But all my handhelds, I have stands as well. So maybe if I'm doing something on a patient, this is a really good. If you're doing, a lot of my docs or providers that are like acupuncturists or massage therapists, they're now having the laser on that muscle group that they're massaging at the same time, and they get even better results. So yes, you can do it hands off. You can even do, like, most of the FDA applications are set it and forget it. It's not like they're doing all these fancy brain exercises, eye exercises, meditate, whatever. They're not doing that in the studies and getting the outcomes. All these studies, and Erconia has the more FDA clearances than every other light company combined. They have, I think they're up to 22, 23 FDA clearances now. But they're all based on set it and forget it. The patient has a headache, you put it there and you go on to your next patient, low back pain or whatever. The longest treatment I'll typically do is 20 minutes with a laser, but a lot of times that's not even that long, and that's not a long time per se, but a lot of my brain-based stuff is around 6 to 10 minutes of application. But then I'll get into things like vagal nerve stimulation with it, where we're doing that brain-gut axis, which is something I'm sure we'll get into. But doing things to help promote. When you laser the gut, it's been shown to create gut microbiome diversity and take out pathogens there. Mm-hmm. Yeah, cool things like that. So I think a lot of docs, because there's so much on pain management and neurological and musculoskeletal with lasers, we kind of lose sight on the research that's involved with my func med docs, my endocrinologists, my naturopaths, whatever. Lasers for thyroid. One of the only things that has been shown in literature to decrease non-cancerous thyroid nodules is violet laser. Okay.
Wow.
Studies have been shown with red laser to help decrease TPO and TGB antibodies, and different things like that. So I don't want the listeners just to think, well, it's only for musculoskeletal, it's only for pain, it's only there's a very broad range of applications. We'll use it with infertility stuff, erectile dysfunction, So the list goes on and on. But back to the treatment, Usually when I'm doing complex cases, I will always give myself 12 visits, just as I call it a treatment trial. Because when I'm dealing with these like comorbidity, long COVID cases, or Alzheimer's like dementia, and they have mold and they have a bad diet and their hormones are imbalanced or whatever, I want to give myself at least 12 visits to see what kind of change I can make at all. But if you look at, like, one of my favorite resources is Dale Bredesen out of UCLA. He's like the godfather of medical research for the reversal of Alzheimer's. And he's a really good resource. His Recode talks about all of these things that we're talking about. He'll typically do at least 6 months of intervention to try and make those changes in brain function. So I don't always have that luxury because a lot of my patients fly in from around the world to come here. And so I may only get them for a week or maybe 2 weeks, but we do these intensives where we come at them from all these different angles. Then we send them home with exercises and things like that. So in a perfect setting, that 12 visits, maybe it's like 3 times a week over a month to start to get those neuroplastic changes and looking at more of those, see the long-term effects of things. But you'll see all along the spectrum there as to what the treatment plan actually entails.
Right. You have to be really consistent.
Yeah.
Yeah. Okay. What can practitioners look for in a safe and effective laser? I'd love to know what are some red flags for listeners out there to pay attention to.
Oh, I love that question, because I think the first question, if you're going to purchase a laser, ask that laser company what their FDA clearance is for. Because almost every class 3B or class 4 laser only has FDA clearance for a medical heat lamp. It's a heating device. And that's how they get their what's called a 510K substantial equivalence clearance. Whereas like Erconia, okay, we're going to test autism, we're going to test peripheral neuropathy, we're going to test pain, we're going to test. So they're actually getting FDA clearances for all these different conditions. Again, and one of the cool things about Erconia is that in their 27 years or whatever they've been doing this, of all their FDA clearances, these are double-blind, randomized, placebo-controlled studies, like the most stringent studies you can do. They have never had an adverse event reported. So that's a big, big thing, obviously. And so I always say to docs, ask the light company, what do you have FDA clearance on? Let me see your research. Let me see your safety. Let me see those things. Because most of these companies, they're riding the coattails of light therapy, because this is kind of one of the new areas, like it's everyone's excited about photobiomodulation and low-level laser therapy. So it's easy to think, well, a light is a light is a light, but that is, absolutely not the case. So one of the built-in things of class 2 lasers is that they won't typically exceed, it takes a long time to exceed that 10 joules per centimeter squared to the brain that I was talking about. So that's why I like that. If you're going to err to the side of one end of the spectrum, you brought up the cap. Most of those caps that you see that may be $800, $500, or even when they call it a laser pointer, that's not a laser. That is scattered photons. That's an LED light source. So that's just scattered photons. It's like shining a red light bulb on somebody. So
does that do anything?
Well, okay, that's debatable. I would rather docs err to that side than the higher powered side if they don't know what they're doing and how to calculate dose and things like that. So that's why you can see all these LED things over the counter, like an alopecia growth helmet or something like that. Just to give you some perspective, we actually, when we do level 1 studies, we have to have a placebo sham for the control, right? Well, we actually use LED as our placebo sham. That's our sham. Yeah, and so you can see, like, true laser knocks LED out of the park, but I wouldn't want to completely. So I'd rather docs do LED-based stuff if they're going to do the brain and they're new to this arena. And then at most class 2, if you're going to get into 3B or higher, you better know damn sure what you're doing to how to calculate dose, time of application, things like that. So class 2 and LEDs, the safe end of the spectrum. And that's why a lot of this stuff, like you can get Erconia stuff over the counter, right? You can do stuff and prescribe it to patients. We do laser rental programs where the patient can take a laser home for recovery for a week or whatever. So I would not feel good doing that. I would never do that with a high powered laser, because again, I'm not wanting the patient to microwave their head. So.
Well, you just actually answered half of my next question, which was, how do we get one of these into our hands if we just want to use it, in our own home? I think that's awesome that you guys have those protocols. But yeah, speak to that. And what is the cost, if you don't mind answering that?
So So I think the big caveat with laser, because true laser, you have to get all of those 80 billion photons per millisecond going in the same direction. The engineering of parallel coherent monochromatic waveforms is very expensive. The laser research is very expensive. So typically, like the base handhelds are about $8,000 for just the red. The GVL gets that new green violet is just under $20,000. So, that's obviously not always attainable. But with that said, my patient base, like last year alone, I think around 12 of my patients bought handheld lasers because they saw how much it benefited them and their family. So it's kind of one of those things where, what price do you put on protecting your own brain? To me, protecting my daughters, I'd pay $1 million for that, right? Yeah. So it's kind of like that. It's a matter of perspective on that. But they're definitely, obviously, that's not a walk in the park for all healthcare providers or patients alike, even though a lot of them are buying it. So typically, in these bigger ones, obviously, this is a clinical setting one. These range, they can be upwards of $45,000 for something like this device. And again, relative to what you get, it's actually a good value. But if somebody is interested in the purchase of it, they could just reach out to my office if they need to. You go to azchironeuro@gmail.com or call my office at 480-756-2600. I can help facilitate that, because then I can prescribe one for a patient. They technically have to have a prescription, but that's more of a technicality. But I can prescribe one for them. Or if they go to ericonia.com, you can see my whole seminar series is posted there. And I'm about to put my 2024 schedule on my website as well. So we'll put all that information in the links or whatever. But
yeah, I was going to say, we'll make sure all those are in the show notes, everybody, if you're listening, so you don't have to jot it down if you're driving.
Even better. Yeah, we don't want to cause any TBIs here. So.
No. You'll have a lot more patients soon.
Yeah.
Let's just talk really briefly about practical strategies outside of the lasers. Dr. Berry, I always think it's helpful for practitioners to share, what is it that what lifestyle changes have you made, and do you suggest to patients outside of these modalities that we've talked about?
All right. Well, I love that, because we have so much power. I really want patients to feel empowered that they have control over a lot of these outcomes. They're not a victim in this. Everyone can move. Right? That's number one. Get up and move. Even better if you can do complex movement patterns, yoga, tai chi, stuff that's new, dance, things like that. And the learning of it is just as important as the actual movements themselves, because now you're creating new plasticity, new, cognitive reserve, things like that, BDNF, nerve growth factors. So you want to do movement stuff. For sure, implement high intensity interval training. Okay? Because then what that is where you go as hard as you can for whatever cardio you're doing. If it's an elliptical trainer, jump rope, rowing machine, all you need to do to get benefits for nerve growth factors and insulin-like growth factor and VEGF and all these beneficial growth factors, peripheral insulin resistance like type 2 diabetes. If you do 6 minutes of high intensity interval training, what that means is 1 minute on as hard as you can safely, that your heart will allow for safely. 1 minute on, 1 minute off, 1 minute on, 1 minute off, and then one more minute. If you can do that for 3 minutes, you have the benefits that are beyond measure. It's one of the most effective tools patients and doctors alike can do. So when patients tell me I don't have time to exercise, like, if you can't give me 3 minutes out of your day, then I'm sorry. I mean, what am I supposed to do for you, right? They've shown in studies, if you do 6 minute interval of high intensity interval training, or to say it another way, about 21 minutes a week, that will have the benefits of upwards of 5 to 6 hours of base cardio.
Wow.
And so that's a big one. Movement patterns, high intensity interval training, doing those kind of things. Whole body movements too, like open chain stuff and isometrics, planking. That's something everyone should be doing if they can orthopedically. Just holding a plank position, things like that. Those are all very low-hanging fruit things. And just getting up and moving, on your lunch hour, go for a walk, get the vitamin D, all that stuff. So movement is number one. I would say fasting is a big one that everyone should implement, because fasting is your brain. That's when you're not getting messed up with glycation stuff and insulin factors and all these things. When you're not eating, that's your brain's chance to repair. That's your brain's chance to take out the garbage. They just discovered a new slime layer that it's called. It's a subarachnoid lymph tissue that goes to your lymphatic system. So it's like your brain, like flushing the toilet, so to speak, getting all those damaged cells, the autophagy and mitophagy, get those damaged cells out of the brain. Well, fasting is one of your best ways of doing that. Fasting will give your brain and your gut and your liver, all that stuff, to a chance to clean up the garbage and repair itself. So there's a general rule right now that you're hearing that's kind of on vogue with the dietary of the 16-8 rule of eating, where you only eat 8 hours a day and you don't eat the other 16 hours. By definition, that will drive your brain into intermittent fasting. Now, there's always exceptions to that because, I'm not going to fast a stage 5 or stage 6 Alzheimer's patient. I'll crash them. If they're severely like reactive hypoglycemic and hangry, like the Snickers ads, you have to be very careful how you manage the fasting of those patients. But as a general rule, intermittent fasting is a good idea. I do a 1-day water fast about once every 2 to 3 weeks, just as a general maintenance thing. So I'll eat dinner and then I don't eat until dinner the next night. So a 24-hour water fast. I just have water. And then I've learned the hard way a couple of times when you go to reintroduce food out of a fast, be careful what you reintroduce because your system's going to be like, don't go eat a huge steak or, something like that. Yeah. Usually I'll do bovine bone broth. I'll do bone broth as a good way to come out of a fast. So that's a really good thing. And then if you really need to hit a reset repair button, like an autoimmune leaky gut, try and work up to a 3 to 4 day water fast, because that really allows your those endothelial cells of your gut lining to turn over and repair. So that's kind of like the ultimate goal, is to work up to a 3 day or more water fast. I love stress reduction. I know that's a very trite statement, but if you want to whack your brain, be in a bad marriage, be in a bad job, be under chronic, those kind of things. I'm sorry. It's like, that's something that we all sometimes have to make that tough choice of like, I have to get out of this situation and decrease my life stressors. There are some stressors that are good, like intermittent fasting and HIIT training, but those are short-term stressors that make your brain more efficient. The thing I like about intermittent fasting and high intensity interval training and things like that, I always kind of joke about this in my seminar. It's like, if you don't eat for 3 days, your brain goes, you idiot, you haven't found a carrot for 3 days. I need to make you smarter so you can go hunt down that carrot. Okay. So that's basically what your brain's doing with fasting. It's the same thing with exercise. You idiot, you just ran 26.2 miles for no apparent reason. All you got was this little medal and a sticker that you finished the marathon. I'm going to make you smarter so you never do that again. I'm not trying to be crass or anything, but it kind of illustrates the point. Your brain is an efficiency system. It's trying to become more efficient, and these are ways that it does it. It makes you smarter so that you can go hunt and gather, and that you don't have to run that long to find food next time and things like that. Stress reduction is a big one. Social environment. Oh my goodness. This is like, you cannot become Howard Hughes, like be a hermit where you're locked in your room and expect to have a healthy brain. You want to stay socially engaged. This is a very understated thing in brain protection. So that's a big one. I'm always trying to learn. Like, I play guitar. I'm not going to quit my day job, for sure. But, at the same time, learning an instrument, learning a second language, doing crossword puzzles, Sudoku stuff, things like that. All those kind of things are stimulating the brain and keeping those pathways active and learning and stuff like that. So I think those are some pretty good lifestyle things. And then last but not least, obviously, diet. The more we have the brain loves ketone bodies. So the more we have a ketogenic diet, good fats, good proteins. If we're going to have carbs, you want it to be, good green leafy vegetables, non-starchy vegetables. Is good for the gut. It's good for, all the immune factors, things like that. So I like, there's some really good kind of diet ideas out there. I like Mark Hyman's work. I like the paleo diet. I like, ketogenic diet in certain settings. I'll rotate patients into ketosis like that. So Mediterranean diet in certain ways. Again, being careful of the Western bread and wheat sources and glyphosate, all that stuff. But, there's always going to be exceptions. Like sometimes patients are reacting to lectins. So maybe the plant-based diet is not the best thing for them. So doctors need to be aware of maybe the high lectins. And, one of the things you guys have always, I've ran over the years is like the lectin zoomer, to make sure if I'm having a hard time about, why is this patient, we've checked off all these boxes and they're eating a really good plant-based diet. Sure enough, we run a lectin test on them and they're reacting to nightshade vegetables or whatever. And so here we are thinking they're eating healthy and they're actually doing more harm than good. So, but diet as a general rule, we want lots of water, reverse osmosis water, non-fluoridated. We want good fats and good proteins. I am not opposed to red meat for the brain. I'm not opposed to cholesterol. Your brain needs LDL cholesterol. It just doesn't, you don't want oxidized cholesterol. You don't want small density lipoproteins, things like that. That's where we should be looking at our cardiovascular markers, but that's a whole other tangent. But so the brain loves good fats. Omega-3s, that's one of the most foundational things. We all, as humans, need to be consuming at least 2.5 grams of omega-3s a day. I always target 3 grams total of omega-3 fatty acids. And so I love nutrition companies that have like IFOS 5 certified stuff so that it's clean of mercury and cadmium and arsenic and all that stuff. But if you're not eating sardines and salmon and all these nice oily cold water fish or not every day, sometimes we have to supplement our way into that safety zone. So that brings in sometimes where we have to do stuff. And our micronutrients are so depleted in our soil sources that it's kind of getting to the point now where I don't want to say you have to supplement, but we're kind of teetering on that edge of like just magnesium depletion, for example, and how many patients are so depleted in magnesium, which is paramount for like it's involved in how many different processes, including brain function. So, and because of surface tilling and soil sources and leaching, pesticide leaching, all that stuff, it's getting really hard. Even if you're eating fairly healthy, like organic and stuff, that's not what it used to be. And so now we're almost getting to the point where supplements are, I don't want to say a must have, but that has to be on most patients' radars if they're not doing well.
Thank you. That's a ton of practical tips, and I appreciate that. I'll be re-listening and then writing it all down.
Yes, same. So many great specifics there. Thank you, Dr. Berry. And with that, I think we could keep going for at least another hour, but I'm going to wrap it up here. You've given us so much. Thank you so much for joining us. You have given so many practical tips for keeping our brains healthy, getting our brains back to a state of health and wellness after something like a TBI, for example, but that's one of many conditions that you address. And lasers, you've really piqued my interest on lasers. So I am going to dive into more research about lasers, and I have you to thank for that. So before we let you go, we'd love to learn more about you on a personal level. So are you game to answer our 3 rapid fire questions?
I'd be happy to do so. You might not want to hear the answers. I tend to be a little irreverent. My goal when I lecture is I try and get written up every seminar for something that people can't believe that I said. So let's give it a go.
Well, now I really want to hear.
I know. I might change my question now.
Yeah. Well, this one you gave it to us, but what do you do in your spare time to decompress?
Work. That's a horrible answer. No. So I've got so many projects right now, and I love, as you can tell, I love what I do. I do have a couple of really cool projects. We've got the applied functional neurology training systems coming in that we're just putting the final touches of launching. So I want to mention that because I know a lot of docs that are watching will be like, I want to know more about this. Yeah, you can go to Erconia.com and see my seminar schedule, but we're actually putting together with my team, not just the clinical side of brain conditions, neurodevelopmental, neurodegeneration, TBI, all that stuff, but also the practice management side, how to implement it, how to monetize it, what your systems are, scalability, all these things work. So this is something that has never been done before, at least to my knowledge and my team's knowledge. And so we're about to bring that to market. So if you go to afneuro.com and just click on that and put your name, if you're interested in learning about having this platform in your office, that's going to be great. So that has honestly, that's taken up a lot of my time recently between that full-time lecturing and full-time practice and trying to keep my daughters out of jail. So that's pretty much taking up my time. But with that said, I am becoming a scuba dive master. So I just got back from Costa Rica. I finally took some downtime. I did some scuba in Costa Rica. Obviously, I love working out. I'll try and golf once in a while. I love martial arts, things like that. But mainly, I'm just trying to get to the gym just to maintain and kind of practice what I preach. But I think I'm trying to travel more too. I've been blessed with the seminar, speaking nationally and internationally. But most of the time I'm stuck working. I don't get to necessarily appreciate where these cities. So. I love travel. That's a big one. I'm going to keep trying to do more and more of it. And I love the beach. I love my Canadian brothers and sisters up there, but I will never move back there. I'm in Phoenix now. It's like 114 today. That's my kind of weather. And then I'm going to keep heading south to the Caribbean, and I enjoy the ocean and the warm weathers.
Emphasis on never. You're never going back.
Never.
I'm a beach person myself.
And we have martial arts in common. I actually train Brazilian Jiu-Jitsu, so it's cool to hear that. That's awesome.
I love it. Yeah, I love rolling. I love doing that stuff. I don't do it enough, but and I guess I mentioned I do dabble with guitar too. That's another good outlet for me. So.
Okay. All right. If you could be a superhero, which one would you be and why?
Oh, wow. Is there a superhero that actually sleeps? Because if that exists, that's going to be who I pick. That's my cross to bear. Anyone that knows me, I am the world's worst sleeper. And, as you're hearing with my schedule, there's reasons why. But if there is somebody that can sleep, I can't remember any superhero in particular. That would be me. I would love to trade places with that superhero. I don't know. It's kind of hard. I kind of like, would Iron Man count?
Yeah, sure, absolutely.
I like what he's able to do. Yet, the kind of the Iron Man Batman thing is, they're real. These are real people, but yet they can do all these really cool things with their technology, with their cutting edge stuff. So I'll say Iron Man, sure.
I like that. I like the tie-in with the technology. Very cool.
Yeah.
And you kind of alluded to this already, but I'm going to ask the question anyway. If you had to choose one place to live for the rest of your life, where would it be?
Anywhere that has a Pacific sunset, that has a stereo I can listen to Jimmy Buffett, and that has a hammock with a coconut drink. And
I'm picturing it in my mind. It's very
so
zen.
Wherever that may be. And one of my favorite music lines of all time is when Jimmy Buffett says, "I got to fly to Saint somewhere."
Awesome. Well, with that, we are going to wrap it up. This was a lot of fun, Dr. Berry. Thank you so much for being here. We'll definitely make sure we've got all that information in our show notes for our listeners. But yeah, thank you for listening. And until next time, everybody, stay vibrant.
Thank you so much. Appreciate you.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.